everyone, welcome to my channel. I'm Dr. Mueller, an OBGYN passionate about women's health and wellness. I created this channel as a space to educate, empower, and support my community when it comes to all things women's health, from periods to pregnancy, hormones to menopause, and everything in between. Whether you're looking for answers to your questions, tips for a healthier lifestyle, or just want to feel more confident and informed about your body, you're in the right place. Make sure to like, subscribe, and hit that notification bell so you don't miss out on any of our upcoming content. Let's learn and grow together because your health matters. Thank you for being here. Hi everyone, I'm Dr. Tony Mueller. I created Beyond Women's Health with the intention of providing a calm, soothing, and judgment-free space for women of all ages. Life is full of transitions, and the internet often adds more confusion about how we should feel during these changes. My goal is to help women navigate these transitions and become the best version of themselves, both inside and out. Beyond Women's Health is a space where we work together to define each woman's ideal version of herself. Whether it starts with improving sleep, reducing menstrual symptoms, or managing mood swings, my ultimate goal is to provide guidance and support through every stage of life. What I'm going to talk about today is my journey into why I created Beyond Women's Health and why I chose to focus on menopause care. It started when I was 41 and I was on the birth control pill continuously to manage a condition that we today know as adenomyosis. This was very new back then because it wasn't something that I was trained about in, I wasn't trained on it in medical school or in residency. And what little we did know about it, it was a condition that we managed with birth control pills. There was never a discussion on lifestyle changes. There was never a discussion on what increased the symptoms or how to reduce the symptoms outside of the birth control pill. And I believe that the Mirena IUD was also another device that helped manage these symptoms. And just to be clear, the symptoms of adenomyosis oftentimes are heavy, painful periods. So I think a lot of women relate to having these symptoms and oftentimes find that the birth control pill is the only management tool in their 40s to, to deal with those symptoms, because oftentimes these symptoms are just debilitating. You're bleeding profoundly, your cramps are just debilitating. And I was at the point where the birth control pill was just not working for me in many ways. It was upsetting my GI tract. It was certainly not managing my moods. So I had looked into how I can manage this condition, given that it was an inflammatory condition. How could I manage this condition outside in a way that did not include birth control pills? So I stopped the birth control pills. I looked into more of a lifestyle approach, and I saw what worked for me, and it was something that I became very passionate about. I had attended conferences on compounding formulations just to learn more about what can be given to patients with these conditions outside of just like the normal formulations. And I also started going to the bioidentical hormone conferences and learning more about that. Now, it's not that I don't approve of birth control pills. I certainly do, and I think that there's a space for them completely in managing symptoms. But I also wanted to be clear to my patients that I do empathize and I do understand what they are going through, and that I can work with them to help navigate their symptoms in a way that can align with a more of a holistic approach and not necessarily just revolving around the birth control pill or the IUD, because not everyone can tolerate the birth control pill, or not everyone is a good candidate for the birth control pill, because again, there are contraindications, especially in your 40s, to taking the birth control pill. So this was really very important to me. And I wanted to share this information with my patients and provide, more of a space where they felt heard. I was going to work with them on how they wanted to approach their symptoms and just troubleshoot and find the root cause. So, adenomyosis essentially is endometriosis of the uterus. Now, we all heard about endometriosis in the past and how it's inflammation throughout the pelvis, but this is confined specifically to the uterus. So I've drawn some pictures over here for clarity. This is a normal uterus. Let's just say it's about 6 centimeters. This is the cervix and this is the uterus. And this is a uterine cavity. And the lining, as you can see, is confined. Endometrial lining is confined to the cavity. Here is a picture of a more heterogeneous, cystic appearing uterus. It looks like a sponge. And this is the endometrial cavity. This is where the babies are held. And this is the endometrial lining, and it's growing into the muscle. So you basically have endometrial glands growing into the muscle of the uterus, creating a more cystic appearing heterogeneous uterus. And so it's kind of like a sponge. Every single month when you have a period, you just have that much more bleeding and that, that much more cramping. We do believe that this is a process whereby we have a little bit more estrogen than progesterone. Could it be an imbalance? We don't really know. But birth control pills, in essence, helps ameliorate these symptoms, but just not indefinitely. I find that for a lot of my patients, it significantly improves their symptoms in their 20s and in their 30s. But as we get into our 40s, the birth control pill just doesn't seem to manage the heavy, painful periods as well. So that's what adenomyosis is. Essentially, it's endometriosis confined to the uterus, and it clinically presents with heavy, painful periods. So let's just say you have heavy, painful periods. When do you go see the gynecologist? We get calls a lot throughout the day. Sometimes our own patients or new patients asking what they should do because they're bleeding for 7 days or 8 days, and it's heavier than it used to be. So oftentimes what we ask is, well, how many pads in a day are you using? How many days has it been? Are you soaking a pad every hour? This is just so that we have an idea of how urgent the situation is. I try to bring in patients that are mine and have already established care to be seen the same day so we can do an ultrasound and evaluate their bleeding clinically. But what concerns me oftentimes is if they are soaking a pad every hour, that is a concern that they're going to become very anemic. And we often recommend that they go to the emergency room to be evaluated so that they can check their hemoglobin to see that they're not anemic. And after they've been discharged from the emergency room with a stable hemoglobin, then we will see them in the office and discuss management. Also, if you've been bleeding for like over a week and this has been going on for about 3 months or so, chances are you're going to become anemic. And we do have to check what your iron stores are and discuss management again. So I know a lot of patients think, oh, well, my periods have always been heavy. Why, what's the difference now? Well, it's going to matter whether it's in your 20s or your 30s or your 40s because the management is going to be completely different, and it eventually catches up with us. And our iron stores are important again for a lot of the way, like the ways in which we feel. And you may not even realize that you're fatigued or that you have brain fog, or there are a lot of symptoms that make may coincide with perimenopause, but oftentimes can be due to anemia, and we won't identify those until you come in and we check your blood work. So again, if you're passing large clots, larger than a quarter, and this goes on for, a good, a week or so, or if you're soaking a pad every hour, um, you have to be seen immediately. And again, the emergency room is the best place because it can help identify cases of severe anemia that may need immediate management. So another question that I get asked a lot is it okay to take the birth control pill continuously? Absolutely. I get this question a lot from the teenagers and the 20-year-olds because they usually experience more heavier, painful periods, and oftentimes that can lead to anemia. So, and also skipping, missing days of school or work because of debilitating cramps. So, my recommendation is that they take the birth control pill continuously, meaning that they don't take the sugar pill or the placebo. This way, they never have that depletion of the hormone, estrogen and progesterone, the bleeding, and hence the heavy, painful periods, and or the severe mood swings that accompany that. It's okay not to have a period if you are balancing out the uterine lining with estrogen and progesterone from the birth control pill, right? The theory that we have to shed our lining every single month is absolutely true if you're not on a birth control pill, because naturally off of the birth control pill, you should be shedding your lining every single month, right? Because the estrogen builds up the lining and then the progesterone sloughs that lining off. But while you're on the birth control pill, the estrogen thickens that endometrium and then the progesterone, sloughs it, and then you have that balance. But if you are taking the birth control pill continuously and never sloughing off the lining because you're not taking those birth control pills, and everything is balanced, it's perfectly fine. You should be able to see no bleeding and you should not have any cramps. Now, there's all, I think it's pretty much impossible to suppress your period completely. Sometimes we're a little bit late with the pill and you're going to get some breakthrough bleeding, and that can happen. I think it's very common to know that, after about 3 months of suppressing a cycle, you're going to get some breakthrough bleeding, and that may be unannounced. It may be frustrating, and a lot of patients don't like that, but it can happen. I also find that that can happen if you're undergoing a lot of stress, like you're in college and your sleep schedule is off, then you're definitely going to notice a little bit more of an imbalance in the hormones, and you're going to get some uh, breakthrough bleeding.